Hello, fellow new grad physiotherapists. In today's video, we will discuss spinal manipulation, especially lumbar spine. Here are some learning outcomes for today's video. So let's get started. What is spinal manipulation? It is an extension of manual therapy, which involves high velocity thrust to a joint over short amplitude at or near the end of the passive physiological range. And there are mixed evidence in the literature to suggest manipulation as a standalone treatment. Most of these effects are short-term, and some of the benefits include reducing pain, improving range and function, and many hypotheses exist to how manipulation works, and it can be divided into biomechanical and neurophysiological. Biomechanical suggests that it reduces the internal mechanical stress on the joint, whereas the neurophysiological suggests that it affects the pain processing mechanism. Contraindication for manipulation, especially for lumbar spine, are like those of the other manual therapy when the right technique is used, and I have attached the form for your reference at the end of the video. Let's discuss Paul's case and work through the clinical reasoning to why spinal manipulation will be a better treatment option for him at this stage. As evident through his history and physical exam, he has acute and chronic onset of a pain with mechanical pattern, no signs of serious pathology, stiffness in his upper lumbar spine, and fear avoidance behavior. In past few weeks of the treatment, he responded well to mobilization. However, the effect has been plateaued and he has stiffness and pain at the end of the range. Firstly, his presentation indicate us in the direction of spinal manipulation because he has a mechanical pattern of the pain, no serious pathology, and has responded well to manual therapy. So manipulation will be extension of mobilization to improve the stiffness and pain at the very end of the range. Secondly, as mentioned in the history, he's afraid of movement. And unfortunately, exercise will be difficult to perform due to fear that movement will hurt him. And as discussed before, manipulation has a short-term effect on pain and somewhat improving range of motion, and which will encourage him to do exercise at home, and more importantly, do them properly. And there is a good evidence in the literature to suggest that combination of exercise and spinal manipulation improve the pain and function in long term. And as a therapist, it is important to establish the expectation that literature suggests the impact of manual therapy is short term and empower them with the exercise to carry the effects for long term. Some of the important consideration for Paul as an amputee is that low back pain is very prevalent in amputees, and it has a significant impact on their physical and psychological health. This is acute on chronic presentation, but he has an underlying chronic low back pain. So it becomes very important for us to understand the causes of his pain. Some of the common causes in amputees with low back pain include improper prosthesis or biomechanical factors such as muscle asymmetry and abnormal gait. So for long-term management, it is important to assess and identify any of those factors contributing to his pain and addressed in our treatment. Potentially involve other healthcare professionals like prosthetists or psychologists as well. Here is his exercise prescription and demonstration.
Hi Paul, following are the exercise you need to do at home. So first one is the pelvic tilt. So bring your hand here on your pelvis and then move it up and down, up and down. The next exercise is bringing your knee to the chest and holding it for 3 seconds. 1, 2, 3, and then bring it back again. And your right knee up. And you can either hold here on the stump or below your knee, wherever you feel comfortable, and hold that again for 3 seconds. 1, 2, 3, and relax. Next one is bringing both of your knees to the chest. Again, you can hold it up here or down here, but I would suggest if you have a stump or phantom pain, hold it down here. And hold it again for 1, 2, 3, and then relax back down. And then the last one is keep your knees together and going sideways as far as you can go. You'll feel a bit of stretch in your back and a bit of a pain, but that's okay. And hold again, and then going on the other side as far as you can go, and bring it back again. Perfect.
Thank you for your time, and these are some take-home messages that can help you manage the amputee in the future and some of the references for you. Thank you.